Hello, hi, good morning. Welcome back to my channel. Today we will discuss about the physiological changes during pregnancy. There are many changes that occurs during the pregnancy. So let us see one by one now. The first one is genital changes. Genitals. We see external genitals and internal genitals. So if we see to the uterus, what happens during the pregnancy? Actually, the uterus size normally is 7.5 centimeters. 7.5 centimeters means the size, the length is just about your index finger. But during the pregnancy, this size gets increased to 35 centimeters. And even the weight, if we see, check the normal uterus, it weighs only 50 grams, but during the pregnancy it increases to 1000 grams by the term of the pregnancy. Not only that one, uterine ligaments, what all the uterine ligaments are there which are supporting the uterus, holding the uterus, the ligaments gets hypertrophy. Hypertrophy means the increase the size of the cell. The cells are same, but the size of the cells are increasing here. By that they will get strengthened and they will have the energy to hold back the uterus while it is growing gradually. And the uterus is increasing in its size by taking the mechanism of hyperplasia. Hyperplasia means increased the number of the cells in the uterus while it is growing from 7.5 centimeter to 35 centimeters or 50 grams to 1000 grams. It has to increase in its number. So it increases in its number by following the hyperplasia mechanism. When it is getting increased in its size, uterus faces some contractions. Uterus faces some contractions. So these contractions are called as Braxton-Hicks contractions. These contractions are called as Braxton-Hicks contractions. And in the cervix become edematous congestion because blood circulation gets increases to this cervix. If you see this picture, observe this picture, you can see the size of the cervix is increased and the edematous formation got increased because the vascularity, otherwise the blood circulation to the cervix is increased. Another thing is mucus plug, you can see from this picture. Mucus plug that obstruct the canal of the cervical canal until the delivery of the baby. Until the delivery of the baby, this mucus plug presents at the canal of the cervix. The softness of the cervix is known as the Goodell's sign. The softness of the cervix is called as Goodell's sign. This sign is very important even for your practicals and for your competitive exams also. This they ask you, what do you mean by Goodell's sign? Goodell's sign is nothing but the softness of the cervix due to the vascularity is known as the Goodell's sign. Next one is vagina. Vagina also shows increased vascularity, blood circulation gets increases, the softness, moistness gets increases. As the venous circulation gets increases in the vagina, it turns into the bluish color. It turns into the bluish color. This bluish color sign is called as Jacquemin's sign. The bluish coloration of the vagina is known as the Jacquemin's sign. Jacquemin's sign. And even the distension of the vagina at birth. So the distance of the vagina also gets increases. And if you observe the ovary also increases in its size, vascularity, and also corpus luteum presents. I already told you once that ovum is ovulated. The remaining scarred yellowish color flower shape is called as the corpus luteum. This flower shape after the ovulation is called as the corpus luteum. You can see from this picture. This corpus luteum gets stimulated by the luteinizing hormone LH hormone from the anterior pituitary gland. So when this LH hormone stimulates this corpus luteum secretes progesterone. Progesterone is the one which supports the pregnancy and also helps in the relaxation of the pelvic ligaments. If the pelvic ligaments are not relaxed, the uterus cannot be grown in optimal level. To facilitate the uterus growth, these ligaments and pelvic organs gets relaxed by the help of the progesterone, which is secreted by the corpus luteum. Now breast changes. Breast also comes under the reproductive organs. So breast increases in size and blood circulation increases to the breast. And the breast, if you feel the breast of the pregnant women, it is warm and tender. It is painful because it is increased in size. Not only that, the sebaceous glands of the breast also gets enlarged. So the breasts are very tender, and even it increases in pigmentation, especially nipple and areola. Primary areola is there, and if you observe here, before the pregnancy and after the pregnancy, the nipple, around the nipple there is a pigmentation that is called secondary areola. And again, the sebaceous glands in the areolar area gets enlarged. The sebaceous glands in the breast gets enlarged and causes Mongomer's tubercles in the secondary areola. We can see from the picture Mongomer's tubercles, nothing but the enlarged sebaceous glands that can be seen under the second areola, called as Mongomer's tubercles. By the end of the 3rd month of the pregnancy, from this nipple, a thick yellowish color fluid gets secreted, that is called as colostrum. Colostrum is contains immunoglobulins. It is very important to feed the baby immediately after the delivery. Next one, skin changes. Due to increased melanocyte stimulating hormones, as the hormones progesterone, estrogen gets activated during the pregnancy, melanocytes get stimulates the melanin production. This melanin causes some skin pigmentations during the pregnancy. The first one is linea nigra. Linea nigra, you can see in this picture, it starts from the xiphic sternum to the symphysis pubis, a pigmented line in middle of the pregnant women, that is called as linea nigra. And the another signs are linea albicans. See the second picture, you can see white stretch marks in between the pink stretch marks, those are called as linea alba. Closma gravidarum is a face mask. We can call as also a face mask. Butterfly pigmentation of the face we can see in a pregnant women, but not in all the pregnant women, but in few pregnant women we can observe this sign, closma gravidarum. Next sign is stria gravidarum. Stria gravidarum means stretch of the abdominal walls, causes a pink lines in the flank and abdomen, those called as stria gravidarum. If in case white women's means we can see pink lines, but in case black women's means we can see the blackish pigmentation in this place of stria gravidarum, because of the abdominal walls or abdominal muscles and the skin is getting stretched. So these stretch marks gets appear on the abdomen of the pregnant women. Now let us see about the weight gain during the pregnancy. During pregnancy, a pregnant woman increases her weight 12.5 kg to 15 kg, especially after 4.5 months. Remaining 4.5 months, she will get increase more weight instead comparing with the first 4.5 months, because during these 3 months and 4 months baby gets formation of internal organs, and it takes all the organs formation for 3 to 4 months. But after formation baby gets increases in its size. As baby gets increases in its size, the internal organs along with the uterus also get increases in weight and also the size. Thus it causes to increase the more weight of a pregnant woman. And not only that one, as the pregnant woman frequently eats because she feels hunger, and her weight also gets increased because of the fat deposition. Besides, blood and intestinal fluids also are more during the pregnancy time. Thus all these things contributes to increase of the maternal weight during the pregnancy time. Next changes are skeletal changes. Skeletal changes increase the lumbar lordosis. Why the lumbar lordosis is increasing means because the uterine ligaments which are attached to the lumbar region, they are pulled forward towards the uterus as the uterus size is increasing. Thus it causes the lumbar lordosis. You can observe the lumbar lordosis in this picture. Lumbar lordosis is nothing but the inward movement of the lumbar region of the vertebral column is called as lumbar lordosis. And relaxation of the pelvic joints and ligaments also takes place during the pregnancy because the progesterone and the relaxin which are releasing from the corpus luteum. Next is urinary changes. Urinary changes, even kidney size gets increased to reach the filtration capacity, and also because the increased uterus pushes the kidneys upside. So thus it causes the chances of more increasing the size of the kidneys. Not only that one, hydronephrosis takes place because these uterus weights fall upon the ureters. Ureters are just behind the are bilaterally to the uterus. So this especially on the right side of the ureters, especially on the right side of the ureters, more weight falls because the dextro rotation of the uterus on the right side. When the weight of the baby is getting increased and the size of the uterus and baby is getting increased, it gets a twist on towards the right side, that is called as dextro rotation of the uterus. So when it takes place, this weight goes and falls upon the right ureter. Thus it causes the vesico-ureteric reflex. Vesico-ureteric reflex is nothing but the urine which is in the urinary bladder, it goes back to the kidneys, that is called as vesico-ureteric reflex. Thus it causes hydronephrosis. But after delivery it subsides however. And also ureters gets dilated because the progesterone is the muscle relaxant. It causes relaxation of the ureteric muscles, thus the dilatation of the ureters. So altogether forms the hydronephrosis. This is all about few physiological changes in the pregnancy, and still there are few changes systematically. I will come up to you with the next video. Thank you for watching. Please share, subscribe and like my videos. Thank you.